funerals, which marked their transition to the ancestral world. Apart from decorating and exhibiting dead bodies for public viewing before burial, modern trends on social media show a disturbing situation where mourners neglect public health concerns and come into direct contact with dead bodies. Today, corpses are often laid in state to depict their profession, passion, or lifestyle when they were alive. However, in the course of doing this, corpses are often desecrated. These practices are fast sweeping through Ghanaian communities. For example, a viral video in which artisanal miners were seen bathing a deceased colleague with water and sand while he lay in state has raised serious concerns. There is also a video showing a group of young men carrying a dead body on their shoulders and parading it through funeral rites. The incident sparked public uproar, compelling the Ghana Medical Association and mortuary workers to react. But despite their concerns, the practice continues unabated. Another viral video captured friends of the deceased dining with the corpse at a funeral. Dead bodies meant to be laid to rest peacefully now know no rest, as some are subjected to bizarre treatment, including being tied to electricity poles while laid in state. Those who engage in such acts claim they are honoring the deceased by reenacting activities the person was known for when alive. Health practitioners have warned that these practices could pose significant public health risk. A medical officer at the Akuse Government Hospital, Dr. Pansy Kelebwedi, explains further.
Once a living organism dies, it begins to decompose. During this process of decomposition, there are some insects with very powerful sensors that are able to come from kilometers away to decompose and feed on dead bodies because of the gases and the body fluids that are released. When they come, they serve as transmitters, or what you would call vectors of diseases. So there are numerous infectious diseases, and these insects can be vectors that can carry them into various homes and then become more of a problem that can lead to various infectious diseases.
Apart from bodily fluids and toxic gases emitted from corpses, dead bodies are also injected and embalmed with formalin, a highly toxic and carcinogenic chemical used to preserve the dead body. According to Dr. Bwedi, public health protocols and guidelines must be strictly adhered to during funeral activities.
All authorities that are responsible, including those that have legal backing for enforcing, and health advocates must all come on board to discourage it in no uncertain terms. In that, according to public health protocols and infection prevention and control guidelines, there are specific ways that carcasses and bodies and corpses are supposed to be handled, failure of which or a breach of which can be catastrophic and lead to public health epidemics.
Health workers are calling on metropolitan, municipal and district assemblies, MMDAs, to intensify enforcement of public health legislations to regulate funeral rites and restore dignity to the dead. The Public Health Act 2021 Act 851 makes clear provisions for the proper handling of dead bodies to protect public health and dignity. Similarly, the Criminal Offences Act 1960 Act 29 criminalizes the mishandling of dead bodies, especially when such actions pose public health risk. Internationally, the Geneva Convention of 1949 emphasizes that the dead must be treated with dignity and their remains must not be subjected to indignity or ill treatment. As the debate rages on, it is clear that urgent steps must be taken to curb the emerging trends that threaten public health and tarnish the dignity of the dead. The enforcement of existing laws, combined with sustained public education, will be key in restoring decency and safeguarding public health during funeral rites across the country.
Wow.
3FM Sunrise. And this is still Sunrise on 3FM 92.7. Live also on all our social media platforms at 3FM 927. So those of you who have joined us on Facebook, what you just watched is a report by my colleague Stanley Niblewu, and I'm sure he told the entire story. Ghana's obsession with elaborate farewells, it is now taking a deadly turn. From overexposed corpses at funerals to questionable preservation methods, if you like. In fact, in some parts of Ghana today, it is not uncommon to find corpses dressed up and seated at their own farewell parties. Mourners around and dancing with them, some taking selfies with them, and in some extreme cases, even sharing a meal beside the dead. It was once a solemn rite of passage. It has now become a spectacle. But beyond the emotional and cultural layers and cultural concerns lies a disturbing truth. These practices would be exposing us to serious health risks. So this morning we're diving into the chilling world of mourning line in state. Are we crossing a dangerous line? In the name of modernity, in the name of fake tradition, in the name of uncultured culture. We've been joined in the studio by Richard Kofi Jordan. He's the General Secretary of the Mortuary Workers Association of Ghana. We also have Collison Atukwe, and he is an undertaker joining us as well. And then Madame Rodelyn Hansen, another undertaker, also in the studios here with us. We'll get to them shortly. But before we do that, we have a health expert also joining us for this conversation. As we look at the health implications of this very disturbing practice. We have Dr. Pansikele Biabwadi, a medical officer at the Akusi Government Hospital. Doc, thank you so much for making time with us on the program. This is a very worrying trend that we're seeing in parts of the country. It's not only for people in the rural areas, neither is it for people only in the urban centers. It is spreading fast and wild. You are a medical practitioner. You're exposed to some of the complications, some of the concerns that this very unhealthy practice poses to the health of people involved. Talk to us. The family members or friends of dead bodies who go to decide to shake hands with a dead body, to decide to dance, even eat with a corpse. What health challenges are there? Doc, can you hear me?
Yes, I can hear you now. I wasn't as audible by the talking now.
Right. So what I'm asking is, talk to us about the health concerns that exist in this concerning practice. You see people sharing a smoke or a cigarette with a corpse, sure. People dancing with a corpse, people even eating with a corpse.
Sure. It is a very concerning trend that has a lot of health risks in today's, in current times, and it should be discouraged, on certain terms. In that, when we see patients, they come with different illnesses, and some of these illnesses are very, very virulent, as we say. That means they are very, very infectious, and they can be transmitted from one person to the other. So for that reason, when we see a patient and they pass on from these illnesses, we categorize them. There are ones that we don't even give them to their relatives because of how the viruses that affect them can affect any other person that handles it. So we have controlled handling of these bodies. And if they get in the hands of relatives who don't go by lay down rules of not having contact with these dead bodies, then there is entry points for these viruses and organisms to go inside the people that touch them, and then they take these viruses to their homes, and then it begins to spread throughout the whole community and the country as a whole. So it is very, very disturbing.
So pathogens from dead bodies can really spread from the dead bodies to the mourners or funeral attendees if we continue with this thing.
Yes, exactly so. Exactly so. Because if a person dies or if there is a dead body, the pathogens, some of the viruses are very tricky. Just to put it in layman's sense for everybody to understand, in that when a person dies, they get deactivated, so they go to sleep. But if they have access to any living cell, they convert from particles and then resurrect. So if the person is dead and the viruses in the person are dormant, that is not to say that you cannot be infected. That is why certain viruses like the Ebola and monkeypox and among others need to be controlled, and the body is not given to the relatives in case they die from those illnesses. So the fact that a person is dead does not mean that the viruses or the organisms or pathogens in the person are also dead. They can resurrect and then live in any other living person and then continue their transmission. So
in a situation like this, how then do we balance the act? What simple public health measures can communities, family, and friends adopt to ensure that they honor their dead properly?
Okay, I think it starts right from the hospital after a person dies. So in the hospital, we as healthcare providers categorize the bodies according to how dangerous they are. We have categories, and we have those. We have procedures that we perform before they are taken to the mortuary, what we call last offices, where the orifices in the bodies are closed, the nose, the ears, the mouth, and others, so that fluids do not come out from these places. So in the hospital, we do that. Then we disinfect the beds all together, and then we convey the body to the morgue. When they go to the morgue, there are preservatives and chemicals that are used to preserve the bodies, and they have protocols, personal protective equipment, goggles, long shoes, double gloves that these mortuary attendants also wear and put on, so that they don't get infected and then carry it to others in the community. And then when their part is done, where the body has to be given to the relatives or the bereaved family, the bodies are encoffined. The bodies are supposed to be encoffined, and they are not supposed to have any direct contact with the body. So they are encoffined. There is a glass screen through which they can see whatever they want to see. And then from there too, there are protocols on how the depth to which the corpse has to be buried. There is a certain feet that you have to go below before the body. So all these laid down protocols are there. And once they are observed, I think we can have a healthy community with less health concerns to think about or bother about.
But Doc, there are family members who, with maybe the utmost good intentions, they are struggling to bid farewell to their family member or to their friend who is leaving them. So they would want to have some form of last physical contact, if you like, with them. How do they satisfy a need like this?
Well, that is not, there is a health aspect to that. So that would be more of psychological. Mm-hmm. So what can be done from the health perspective will be some form of psychotherapy or family therapy, counseling, sometimes depending on how shocking or how devastating it is and the bond that has existed between the bereaved person. So the health perspective from which we may come in will be psychotherapy, counseling, talking to the person. But if it comes to, or if the person wants to perform certain rites, physical rites, or is it guard of honor, or anything of this sort on the dead body, it is not advisable. I mean, left to me, I would say if you have anything to do, any quality time that you want to spend with the person, then it should be while the person is alive and not after the person is dead. If you have any loved one you want to tell you love, tell the person now. If you have any good thing you want to do, if you want to be a benefactor to someone, do it now. I mean, we have this culture where we honor the dead more than the living. We have, in our hospitals, there are patients that come, they're unable to pay their bills. They are supposed to pay for oxygen, they're unable to pay, and then because of financial constraints, they pass on. And immediately they die, you see swarms of relatives coming to pay for the body. You know, like, where were you while the person was alive? So this is something that has to be discouraged as a society, as a community, as a culture. We have to really tone down on honoring the dead, making big signboards, expensive signboards for the dead, without minding them while they were even alive, without even checking up on them to say good morning while they were alive. So if you have anything to do, it should be while the person is alive and not when the person is dead. But if for any reason the person is in shock, the person is unable to come to terms with the bereavement, then the health aspect you can come from will be psychotherapy and family therapy, where we will console you and then talk to you.
Doc, I'm reading a question here, and it is seeking to say that what do you say to those who go to the funerals or go to the laid in state days? Maybe the corpse is being laid in state for 2 days, but they are not touching it. Would you allow such people, would you allow people to go near the corpse, not necessarily to touch it? Would you even allow children or adults near the corpse lying in state for more than a day?
Such under controlled circumstances, such situations may exist in that the bodies are covered, they are encapsulated wholly. So there is no possibility for viruses to exit through the coffins into the outside environment, because they would have to come through maybe body fluids. And in situations where the body has to be exposed to the outside environment for such a long time, they are embalmed with certain preservatives and chemicals that can prolong their stay before they begin to decompose. So those circumstances may exist where the necessary things that need to be done to preserve the body for that length of time, if you have preemptively thought about it, may exist. And children, pregnant women, old people, everybody gather, we all come to the funeral ground. Some of these people are categorized as immunocompromised, in that their immunity is not as that of adults. So we have to be very careful, even in as much as those things may be permitted under controlled circumstances. We have to be very careful allowing them to come too close to dead bodies.
So, Doc, essentially two things: that pathogens in the bodies of the dead people, as well as the chemicals used in the preservation, they can be very harmful to the living if they decide to go and play, if you like, with these dead bodies.
Yes, definitely. Definitely. Yes. With regard to the chemicals, some of these chemicals, largely formalin, that are used, they are known to be, they are indisputably known to be carcinogenic. That means with continuous or repeated exposure to these chemicals, they can, they can lead to cancers, different types of cancers. And even without that, for health care providers and health professionals that come into contact with dead bodies, doing autopsies and all of these things, we can attest to how strong formalin is. It is very pungent. It irritates the eyes, the nose. If it touches your skin accidentally, you're going to have irritation for a number of days. So it is a very strong chemical. And I mean, for you to be touching, I'm sure all those that have touched dead bodies, if you could call all of them and, I mean, question them and ask how they felt after they went home, they would definitely testify that or admit that, yes, they had some form of disturbance to their skin or their nose. Right. So these chemicals are very, very poisonous, and they are not supposed to be handled without protective equipment.
Dr. Boadi, thank you. Thank you so much for your time with us on the program. We've been speaking with Dr. Pansikile Boadi. He's a medical officer speaking with us there. Let's still stay on this conversation and invite into the conversation a sociologist, Dr. Kujoji Akpagbili Honu. He's joining us on the phone line. Doc, thank you so much for your time with us on the program. Where is this, I don't know whether to call it strange, I don't know whether to call it new. Where is this entire thing coming from, Doc?
Yeah, well, it is worrying to everybody. But indeed, when you look at the situation globally, and particularly, let me send you to Philippines. On that island, there is one particular island, and I know it is a common phenomenon in most of the Indonesian islands. Corpses remain as part of the families. And so if you see the way they treat their dead, you would wonder. A dead person is believed to be home and not dead. So long as they keep the dead person at home, it is believed that the person is not dead. So they serve the corpse with every food that is prepared at home. At night, they turn on the light of the dead. In the room in which the dead is, they turn on the light. When they are praying and they don't see the dead there, they only believe that corpse is sleeping. And you know what? Poor people keep corpse at home for weeks before the funeral. The rich for some months before the funeral. And for the high class, it can take a year or two. And they treat the person as if he's alive.
Right, but Doc,
because
this
they believe that he's part of the family.
But this is not African. This practice is not Ghanaian, is it?
But believe that we are now in a global village. We are in a global village. The living are dining with the dead. The hands of the dead is in the dish, and the living are also taking food. I just listened to the medical officer. Such corpses are preserved with very powerful, solutions, which is very injurious to the health of the living. But do they care? They are paying their last respect, and that is how they want to pay their last respect. If they do that, they feel satisfied. Psychologically, they are satisfied that they have carried out a befitting funeral for the dead. And that dead is very close to them. So what is happening in Ghana is to show how close they are to the dead.
So do you think, Doc, what is happening is a matter of cultural pride, status, symbolism, or something deeper?
You know what? I mentioned something earlier on, that we are in a global village. Social change. When COVID came, we were not even supposed to get closer to the dead. Because if the person died of COVID, it could be disastrous to those who gathered around. People waited patiently and kept their dead bodies until after the COVID. Because for them, it is very symbolic to be very close to the dead and show that they really love this person and show that they are very close to the person. It is a way of displaying how close they are to the dead. And that is what is in vogue now. You see.
So, Doc,
in the place I earlier on mentioned, in the Philippines,
right,
in Indonesia, you see people sleeping on the same bed with the dead.
So is it possible to evolve our traditions, Doc, to reflect both original Ghanaian culture and values plus public safety?
It will be difficult to want to restore what used to be the case, because as I mentioned, culture is dynamic. As we move, introductions are made, new faces are introduced into our cultural practices. And once people decide to show love to the dead in a particular way, you realize that others will also see it and copy it and begin to implement it. Yes, traditional or ethnic groups and their rulers may want to maintain the status quo, but the eagerness of some people to show how close they are to the dead will be a very serious obstacle. And can there be traditional legislation to prevent people from showing love to the dead the way they prefer to do it?
I see.
Look at what the medical officer said. It should send shivers down the spine of others who listen to this. Some may say, hey, it is dangerous, and therefore from today I will not get closer. But how would others also take it?
And Doc, this will be my final question to you. How then do we begin to shift mindsets around, this disturbing development? Clearly, it is a public health risk. It is something that medical officials, officers are telling us not to encourage, but it is happening because of the adaptation of culture, you say. But how do we begin to shift mindsets because it is not a safe practice?
Yes, it is not a safe practice. And that is also a good question. It takes an assembly of some experts. The medical officer, you're talking to me as a sociologist. Maybe you get a sociologist, the psychologist, the environmentalist, and so on. They come together and begin seriously, in conjunction with the civic education. We come together and then begin to talk around the table to educate the public, after which NCC will take it up.
Thank you.
If we only have a viable the National Commission of Civic Education, then they have to take it up, decentralize the education to reach every corner. Maybe some documentaries could also be shown to, warn people against this practice, which could spell doom to a whole group of people.
Right.
Because once there is problem, it affects so many.
Thank you.
Those who get close to them. So education is the prime remedy.
Thank you.
Thank you.
Doc, thank you so much for your time with us on the program. We're speaking with Dr. Kojo Akpabli Honu. He is a sociologist speaking there. I still have two gentlemen and a lady in the studio with me this morning, also to talk about this disturbing development. Let's get into the conversations with. Let's start off with Mr. Atukwe. So you are an undertaker, just like Madam Hansing is. And you've likely witnessed firsthand how families request for corpses to be dressed or posed or presented. From where you sit, how much pressure is there to, quote unquote, perform with the dead?
Thank you very much. And I go for?
Yes, please come forward, please.
Thank you very much. And it's very, very nice to ask me this question. Sometimes we have challenges when the body is bringing to the house to dress up. And the family members will tell you to do it like this, and you also want to do it like this. But
so there's the demand. People
demand.
How frequent is it?
Maybe the kind of group the person is before he dies. Sometimes they wanted you to do it such a way as if he's alive. And the family members will tell you, or you also do it this way. But still, the family members don't have the right sources to get the person.
So okay, what I'm asking is, would you be comfortable with Chi? Okay. So pressure damoso say monye sa performance way.
Pressure die super.
Okay.
Pressure die so we say. Won say akoye say ebusuano maybe ebusuano enyo mu na eto adaka enyo mu na omu to say. Nti omu be frɛ wo no. Ebusuano wo hobat omu be frɛ wo no. Na e wo situation a na nkrofo no nipa no ote ase no life owo mu. Nti omu pese wo ye ne saa. Sa wan ye ne saa na ebusuano se ye ne sei a edi akasakasa ni ntokwa ebeba nti pressure de ebi da super
nti ebe say ebia bosome ejuma wo ye bosome no mu no dodo saying na ebia wo ye 10 in a month wo ye ejuma 10 in a month 10 no emododo saying na abusuafo ana namfofo no eka che say sisi no man international yemfa ni miasa Mayafa, you perceive the George Shannon, no, Sani Maniamano.
Obese trade,
I see.
Trade, Ubenya.
I see.
Trade Ubenya pa say young boys, ni young girls in the air. Ekobano sadia, and no the pressure, no the sunsin. Bibia, but once Obi when you know, omo pesa odene daho because Obi wa hawa bread dada. Na usad udene kotrasia. Sebi udi ni transi ububu no ansa na udi na transi na ebi so akọ bubu yi na ninsa no dompena eyi o ana se enan no dompena pie wo ha adwen
okay
de ebi awusu nim obetumi asweti na ameti na afọ usu musu anu no na akofa yare fufuro e di abamu.
Madam Hansen, also here undertaker sir. But your microphone, Mami Kakra. Is it any different from where you are?
No, it's not different.
Get closer to the microphone, Bacho. So it's not different at all.
Yeah.
So how is what's your pressure like? What's the pressure like?
Okay.
What's your country?
Let me say in a dear. I'm the bar. Me catch on plane. Say me to me.
And see, I'm the bad to do pa.
I'm the bar.
See,
especially young ones. See. If you shine bet me catch so you say me nipa no a live boy, no a live girl, or a premier new. Until you per se and say. Me to me catch on plane. Say me sad no. Says na me colleague ne kano. Ye bubu. Na bubu ni cry nya easy sir. Enti ebia nipa no wa bre wa yare ada ho ansa na owu ni na wo san ko bubu ni aka ho enti me die omo di ba me reject me nje so pese me deda nto empaso ana adaka mu a meye ba se ye di ne be gina ho ana ye ne be tena ho die me nye
but request ne ba say ye
eba
omo de ba ayana sika no dos wan answer den
oh sika no so endorse sa o onka say openi say o o mouse kan na wo giwie a no aka say e bia 1 week time no afrɛ oh auntie Rhoda me patrol na me bra no ana me sister no was say ni say nti ye pese yenya ni say
I see
nti o kan na maka che ni say okay eni ma me share o me dey say adwuma ni dey me nya because enye say minim ye but it's not advisable.
Let me bring you to the conversation, Mr. Kofi, Richard Kofi. You are the General Secretary of the Multi Workers Association of Ghana.
Yes.
From your professional standpoint, how safe is this growing trend?
It has never been safe and cannot be safe anytime. In fact, we from the mortuary cannot guarantee any safety from the mortuary to the house. So, in fact, if you have a brother who dies today, the advice I always give is that see him as your enemy so that you distance yourself for your own safety.
Why is that?
You go to our mortuaries where bodies are kept on bodies, someone is dead, and you've seen some videos in our various facilities how they are. It's not a safe place at all. Even the use of the chemical that Doug has talked about, formalin itself. You know, as you release the body from the mortuary to the house, the fluids start coming out. So when you're always getting in contact, even the formalin itself is a problem to you.
You the health person who is giving, the mortuary worker who is giving.
It's not only the mortuary worker, you, the family.
Okay.
Who is going to get in contact with the dead body. The formalin itself can pose health risk to you.
True.
Apart from that, the pathogens and the small fluid that comes out is a very serious matter we are talking about. And when you die, like Doug has said, it doesn't mean that the diseases or the viruses are dead. They are with you. Our mortuaries are the most dangerous place in this country. If you go to our various facilities, you'll be amazed to see that we are actually keeping a breed of diseases in there. I went to a mortuary yesterday. I was like, how? That is what I kept asking.
Why were you?
The place is very messy.
I see.
To the point that, like you've seen, fluid here, bodies are kept on body, very unprofessional, you know. It is not the fault of the workers. It is the fact that there's no space, number one. So one body will be kept on another will be kept on another. And your brother who is dead already is going to take in, he's come to make new friends at the mortuary, he's going to take in some disease from the mortuary. You know, there is no mechanism or any equipment which we use to clear off any sickness that the person is carrying. We only give as it comes. If you die of HIV and you come, we give it to you back with additional disease. That's how it is.
So for the association, why haven't you taken a firmer stance on this disturbing practice?
We have. Remember that there is a regulator, both for mortuaries and funeral facilities agency. I was a former board member. Their mandate is to make sure that these things are curtailed. It's not only them, there is also a Public Health Act, which was passed in 2012. If you read section 54, 55, it stated clearly that this is a criminal offense. It is criminal to handle body in this manner in which we are seeing. But nobody is talking about it. I've always said that the responsibility for this thing to stop lies on all of us. The traditional leaders, the police, the public health officers who are everywhere in this country. What is their mandate? Prevention of all these things. But it's not happening. So we have all given up, and that is where we got into where we are now.
Some bodies are also kept without refrigeration.
Yes. When it is embalmed, it's possible that it might not need fridge.
Okay.
You know, the chemical is so strong it's able to preserve the chemical for some months or days.
So if you're comparing that with a regular one, is that not unsafe, or they fall in the same category?
They fall in the same category. There is the chemical is only preserving the body. The fridge is also preserving the body. You're doing the same thing. The only thing is that maybe you might not have enough, the light off and all that, so you want to have chemical. This is a modern way of preserving. In the advent of light offs and things, I think people develop some means to preserve bodies without necessarily putting them into the fridge. So they do the same thing. The only difference is that one is chemical, one is just free direct. But even before you put the fridge, in modern times, you put chemical still.
So this chemical that you put, like you've already mentioned, it has severe impact on the health of the people around.
Seriously. That is why every day we are losing mortuary workers all over the country. In fact, since last year we lost over 50.
Yeah.
Every day.
And you even are the people who are trained to do that.
Exactly.
And it is much of a risk to you. How much more those who...
Exactly. How protective can you be? You think you are protecting yourself when you're here. And the risky part is the undertakers. They come in, some of them. They feel like, bare hands. They bath the body with bare hands. They do everything as if they are not going to die. And they are the most, in fact, they are causing all this mess. As for the mortuary we preserve, we deliver to you. From the time we deliver to you to Tiberia, we are no more involved. They take it from there. See, so. But what I'm saying is that the mortuary is not a safe and can never be a safe place for any diseased person.
So, Mr. Tukwe, let me come back to you. So, when you do your job, and then the person is laid in state, and then you realize that this is the kind of thing the family or the friends are doing, would you, apart from your job personally, would you want to go near a body like that if it was not part of the duties you were performing? Say, body no ako year free, mortuary where we why any abe or body no hu. That's a busiane de body nesi ho, and a day jot ashena no. Ana oteho or kaiska obekwa kwetena ne nchen. Personally, would you do that?
Dabi. Say experience a me wono any addition mesua e wo ho no eno de me ntumi nyesa me de say me dress wo body ma wo na de ebesi we kire de eno de ebusuafo ne amanfo na asem kire say ye nim say ye kwa before ube so body mu no ube she gloves ube she nose mask ube say because formalin na ye boss e ka no formalin no kra no say ube no ehihye weni ekonrim ehihye enti before obedu ho no ese uye san nyama we nyina uhihye gloves ne nose mask ansa na why my area dia eno dia mini ya omu de job to see na no o man fa see na no eno dia enye me masem say me ma be ye mejuma awie dia wo say me ye no my
Madam Hansen, enti abusia for na ya omo requested for we no dia no mo pe dia no mo pe so mo hu. Is it so the people will know that ajuma na ni pay oyeni, and I say it gives them some form of societal what is the reason why say by microphone ma me sure
say omo no say no omo pese amanfo na area no enhu say nipa no ajuma a oyeni into wu ye no ye pese yenye ni say na amanfo hu say ajuma a oyeni but ni nyina mu no me de bia me ka say it's not advisable enye because na me boss e kan sa body bi wo ho akofa kra insem e woni hu no body ya adware no ye de ma wo se be ye ni hu adwuma wo hwe efie woni hu pa no want to me fa sa efie ni enye adwuma ni ntaji se wa pensio any debtor ni nyoma na wo dia paper ni hu nyina ansa enti se ya address body na yue na mo se me mo die me nye bi da me kai say me try say me ko sua sa asitna no me first time me do nipa no ho no oi masa me suya ma me pie ofra me sa up to date because the way a man na omo ye no ansana ya to me the nat na say no de bia me ka enye.
I see. And see, Mojuma Nimono, is there a regulatory body, association, be so to ensure that these things does not happen, Anna?
Yeah.
But because but say other undertakers be or Omoja say Jumani be here.
Aye, Omoye.
And see, Omoya Sano. Mo association be or a group body be or why Shemoswana.
Aye. Mofa for no.
Okay.
Sesia omonia bre was adie no. Omo say sesia obia undertaker bia ye be ma wo say adwuma no na wo gi ye corrons ne ye hu say wo yes say adwuma na wo di nipa na agina na wo di nipa na tena ho a one omo be chiu ye be chi abusua no body no so ye be seize body no.
Zatukwe now can be
entina ya form association Greater Grand Undertakers Association. I think say you will Kumasi, you will be with Volta, and I will be with Uti Krano, and me say next week, and ye be BA Omwano. Mortuary and funeral facility agency no omama say your art or is it at 289 say obi wu a the last respect the demand say odaw they say uti konso na mami nkasa na saba
for before
na say oh otra konso nti yemfa ni tra ona konso sinenim oh say wan yes abe we ka say oh e bia na unnim ejuma na ye ntina but minim ye pa ma yesa but mbe hu say mra wo ho a say o yesa ejuma na ye be chiwo no o ka kire me ka kire say masa so far as I'm here greater Accra undertakers for general secretary mean to me enye say ejuma no na minim mra no wo ho no no de mean to me nye I have me wo ejuma 21st nipa no a DJ oh kanishi omo frame me omo me no maka bibia later omo frame me ka kire me some person time ka kire me say no way me nye omo tie me explain it omo no omo tie ase mo maka ka kire DJ association na Spinners association say oh nipa no di mrano ato ha maye ambaso ebusuafo no so say the way a master say okoto say dey obi transi pa na ye no odem ya ye dey no be transi no punishment because I search you enti say you bubu be bia ti say who life inside to me call e buy say you bubu be bia and you very serious e bi wo ha ubu a na don peneji e betumi awo I have that experience before oh minsa we enti ya association say obi an join association e be do brave association no say uja undertaker na ukoye ejuma I think say omo my art no ye be chiwo e bia wo ntumi a ye be chiwo wo be ko 6 years and I say 5 years ukoye say ejuma na e chiwo enti ye members no they are aware who from they will tell you either say nipa no be down.
I don't know whether I don't know whether you've heard of people getting sick after being exposed to, you know, dead bodies in that form before.
Yeah, but let me tell you that the one you see where they are carrying the body. Our information is that all the guys who carry
they are dead.
They are dead. Yeah.
So it's not only sickness.
Which people are you talking about?
The video you just showed, the one that
Achimasim
North one. There's one where the guy was wearing white and that one. We understand that the 3 guys are dead.
And also those who
all those who carried him and handed him gone. Whether it is from spiritual parts, whether it is from the disease, we are not sure. But what we are saying is that it is not a safe practice. It is not in the interest of this country. There's no positive gain. There's no positive gain from this act. I've not seen. I don't see why someone would decide and say, my father is dead, so let the undertaker punish my father. They're breaking the hands, breaking the legs to sit down. Then you expose him. I think society, where we've gotten to now, this is what I think. My personal view is that the type of funerals we want to see and the drama associated with it, that is what is going with all these things. People want to see drama. Boys come to drink and then they want to see some kind of behavior. And that is the level we get into. Unfortunately, it is not in the interest of this country for anybody to opt for that option. Not at all. Not at all. Even in a room where you have open casket where people go around, I don't do that. It's even itself public risk. Yes. Because the scent alone, scent of the formalin alone itself is risky. So I don't see what is so nice about it, what is positive about it, why should people even practice it. But you realize that those who do that, they are always under some level of influence.
I see. Well, I'll say.
I mean, not spiritual influence.
I get it.
You understand?
It's not a wise thing to do. So you'd want to close your eyes before you do it. I see.
I don't think that you, as a media practitioner, the media people want to opt for such an option, especially when they are very descending. They know very well that, look, this guy is a presenter. They want to give you a very nice, befitting lie in your suit with your whatever. At least even if you want to put mic and things beside you, we should be lying. But when you are forced to sit as if, look, when you are injected with formalin, you become stiff. Unfortunately, people don't appreciate it. They only come and say, yeah, they say, They don't know the hustle the undertakers go through to even meet their demands. You are already stiff, your leg cannot bend. That's what it means. It's like putting fish in the freezer where you have to even cut yourself as you can cry. It's not easy. You are supposed to bend and break that leg. Oh, nipa we will sign over punishing as a worker. And they say we are not no.
Mami, let me take your words again. So, Madam Hansen, what would you tell colleague undertakers and family members or friends who are demanding for these things to happen, are demanding for this as the final funeral rite of their beloved?
Me dear me wa meka akire bushia any me colleagues nyina say sisi aye pa omo acho obi di say adwuma ni bi brewo a che nipa ni say ya jai ye because we ya ye be chill ena bushia no so sisi aye pa omo cho nipa no wewu wakoshe fridge mu ye de duro aka no wakoshe fridge mu e bia 2 months 3 months ansana ya yino enti omo de adwuma ne ba omo ye titi se na ye dressing crofo no enye mpaso a ya adaka mu omo ma ye nya se adwuma no na enye fe de nya ne se wo be take you time address body no neat se ne be ya amanfo ba na omo be hwa ka se o ya ye no fine yo dan dia ya be ka se ye mbubu ne ye mfa ne ntena ye mfa ne ngina ho eno dia me pa abusua bia cho any your colleagues no say obi di say adwuma ni ba ye panicho on reject it because would this asika na echi na wo ji say adwuma no na ye chi wo a ene me kura metumi ayiwa ama because me hu a me frɛ na ma frɛ me boss aka chen say dear cousin ni no mama mofafo no the police be ba baby a wo ye adwuma no
ene wo fam kwa
Atukwe, so what would you say about all of this?
Dear me can say yesre abaino say sisia the way ye handle funerals ewo dead body ewo Ghana hanumu enso eni ena emfata afidie ye municipal assembly no so omo form na nsi ho say omuhu saa se ye bisa anase boys ye yesi yemfa nipa ne ntrase ya fa no wadaka mu ye de ye ni se no yesre aban no mfa mra ento opa because sesi ano ema social media wo social media kra the way omo handle bodies ni nyama no enye na mi colleagues na omo ye undertakers no so no ye de chopper momu enti na ya form association no ye wo nkrofo a ebe kire the way a uko dress body a ubeye ene yi enti ye dis ye na eni ye kotodwegu form se ye pom cho se obia enjoy ni association no nema ejuma no nye baako se nipa no wu a wewu ni last respect ni se ye nsiese no nda ho no nye ye mbehwe no na nye fe ye nka se ye bubu no na yemfa ne njira ho anase yemfa no ntwire ho yemfa no ntwire light pole yemfa no so obokube otonkube nti na obokube opia trog nti na ya dida na opia trog dabi yes rese obia yemfa mra no ntu oyie mra no ese ye hyemu kina both undertakers na ye wo association no yemfa mra no ye hyemu kina na engina na ye nyina ye hu se mra na egina nti egina obi ntumi nka se me the body etra ho na ebusuafo no so no yesra mu se nipa no wa life mu no owo ekwan bi a enya na yesi undida no nye yi a yesra ebusuafo so se yesra mu omuso ye pa omucho na omunya abutre na yendida nipa no nda ho na yema ne last respect no that's it.
Mr. Jordan,
yes.
for you and your association,
yes.
Is there any more you can do on this?
Yes, we have always been doing, like we are here. It's education we're doing, right? So we are appealing and we'll continue to do that. In this respect, apart from us telling you that it is not safe, the onus lies on the undertakers who finally do the standing and the lying and all that. So we will still continue to work with them, we'll urge them But to urge the general public, the police, every funeral you are likely to see a police officer around, whether in uniform or not. Every funeral you are likely to see a traditional leader, whether in dressed traditional or not.
Yeah.
You are likely to see an assemblyman, likely to see the traditional people around. Let us all understand that it is criminal by the Act, Public Health Act. It is criminal to involve yourself in such activity. And therefore, when we see such things, I think the law enforcement should be informed them. Let's set one example, two example, to deter the rest from continuing this act. Otherwise, we are all not safe.
Yeah.
Well, since you're here too, yesterday you said you said today you said
Yes.
you visited a mortuary.
Yes.
When was that?
Yesterday.
Yesterday, and then you were disturbed at what
Yes.
you saw. So, what is the current state
The
right
state
now?
of our mortuaries are still, in fact, even worse off. Let me not say. Remember last 2 months, Kolebu declared that they were going to do some renovation.
Yeah.
That they were going to. Some fridges were broken down. Fine, it's good news. I even supported that they need to do that. Most of our public facilities, apart from the ones that are new, are in a very, very disturbing state. To the point that if you ask me, many of them are not fit for purpose. Many of them are not fit for purpose. For some reasons, mortuaries are managed by facilities in which they operate. Unfortunately, people are not willing to spend the small money they get into renovating and then making sure that there's value for money. And so it is what it is. We have always advocated for our mortuaries to be in a safer place. Mortuaries should be standardized, should be nav and ventilation. Unfortunately, where I got to yesterday, I couldn't breathe. No ventilation, it's just a room, some rooms with some holes, and they call it a mortuary. I think that going forward, MOFA, what is MOFA? MOFA is Mortuaries and Funeral Facilities Agency. Their mandate is clear. They are supposed to regulate, license and control all practitioners and facilities that are involved with storage and disposal of dead bodies. So that is their mandate. In fact, they are supposed to even license all undertakers, anybody who has an intention to operate or practice as an undertaker, they are supposed to license him. Any mortuary attendant or embalmer who want to practice must also be licensed. Even the haze drivers, from the point of death, where the bodies are going to be taken from. Because it's not only hospitals that people die. People are dying at home. We have seen taxis and some private cars carrying dead bodies. Itself is another risk, which is for another topic. But we are saying that everybody should get involved so that death care becomes, we see our funerals as tourists, whatever. People have even advocated that we're going to use funerals as tourists. Trust one of the presidential candidates. He said he was going to use funerals as tourists.
Funeral tourism.
Yes, funeral tourists. If that is true, why can't we then beautify it? Because we are not in a very good state. We are actually in the negative.
So I'm sure these were part of the reasons why you, the last time, wanted to embark on the strike. That
part of it, in fact, especially with the protective equipment, where Doc has stated that with the nature of our job, you cannot, respectfully, you cannot be working without your protective equipment. What you are doing is that you have sold your life to the viruses and the pathogens.
So do you now have them?
No. We still don't have. We're still in the same mess. Some, let me be fair to some.
Yes.
Some facilities are doing well. Many of them no.
What has been the engagement between you and the authorities?
We keep engaging. Even last week, we met the Ministry of Health and Ghana Health Service. We're still engaging. We see, they'll tell you, as for PPs, it's a general problem across the country. Even doctors struggle. And this is the excuse that I want you keep telling us. Which is not good leadership.
So how long are you taking it?
How long, I'm not able to tell, but anytime soon. Because you see, the law is clear that if I think that I am not safe in the environment to which my employer has put me, I have that right to withdraw my services. That's the law. I'm not the one who actually enacted the law. The Labor Act 203 stated it clearly that when I feel that I am endangered, that my life I could lose my life out of the negligence or irresponsibility of the employer.
Yeah.
I have the right to withdraw my services. So we are still negotiating. We are still talking. In fact, we need to negotiate for PPEs. No.
How long has it been?
So long. So long. In fact, since our mortuaries were in place.
So how long, when did you call off the strike, and up to now, how long has it been since then?
I think we called off the strike around December. A week or two to the elections.
Okay.
We threatened.
And up until now?
Up to now, you know the normal excuse is that we just come to power. We are assessing, we are auditing, we are looking into the books. We want to see what people need and all that. So what do?
Is there another action? I'm not talking about industrial action maybe, but if that's on the table, fine. But is there another demand you're going to make to...
We've made demands already. There are demands that already are there. We've never asked for anything new. We have always stated that all the things that you have agreed on since 2020, 2021, do them. After which we shall think about what is next. There are a lot of things that we needed at the mortuary.
So you wanted to strike because you needed them?
Yes.
Now you don't have them?
We don't have them.
But you still called off the strike because...
Because you were crying, you.
Because they were negotiating with you?
No, you were crying.
Now that you still don't have the things you were asking for,
yes.
Is there another strike in the offing?
The strike will always, as a union, remember, strike is always the last resort. We are not quick to decide to strike. We want to negotiate, want to sit down, want to judge, or let's have solution. They'll tell you, okay, fine, give us, don't write later, it will go. It takes time. The problem, the challenge is that the internal generator funds to them is not enough to cater for many of the things on the ground. To the point that they are using the same money to pay for workers who are on casuals and all that. Not only at the mortuary, but around the facility. If I'm the CEO and I'm supposed to use the internal generator funds to cater for many things, I will be cash strapped, and that has been the challenge. Yeah. So, and you see that, look, we have said that mortuary is a revenue center. It's a cash center. It's not a place where we always make money. So invest at least some percentage, 5%, 7%, back to the mortuary and make it a nice place. Unfortunately, it's not happening because nobody is supervising anything. Yes. Come on and say, brother, say, little prayer for the world. Sister, say, little prayer for the world. Everybody came and say, little prayer for the world. Tell them good Lord above, that the world needs.
Gentlemen and lady, thank you so much for your time with us on the program. We've been speaking with Richard Kofi Jordan. He's the General Secretary of the Mortuary Workers Association of Ghana. We've also had in the studio Kolising Atukwe, an undertaker, also speaking with us, as well as Madame Rodelyn Hansen, also an undertaker, helping us with the conversation. But on the phone lines, we had Dr. Pansikele Biabwadi, a medical officer at the Akuse Government Hospital, as well as Dr. Kojovi Akpabli Honu. He is a sociologist at the University of Ghana. In the end, the dead, they deserve dignity, not danger. We know that tradition is evolving and modernity is creeping into our rituals. But we must ask ourselves, are we honoring our loved ones, or we're simply feeding a spectacle that is risking public health and disrespecting the dead?